And then I'm just going to thank our sponsors. Our lead sponsor is Mountain One Bank. And then our event supporters are Cardinal Cushing Centers, Crystal Moon Holistic Healing. Here, wait, cut. Friendship Home. George Washington Toma, CPN Appliance. Phifer Pinkham, LLC. South Shore YMCA. I think I can make it. SteinbergHR. Tiny and Sons Auto Glass, Unique Stairways, and Wellspring Group. So we're going to start. Sherry is our moderator with Dr. B.
Wonderful. Thanks, Heather.
You're welcome.
So good morning, everyone, and welcome to the Women's Leadership Spotlight today. We're honored here to feature this extraordinary guest, Dr. B. And she is the founder and CEO of Concierge Medicine of the South Shore and Hingham.
Good morning, everyone. I'm excited to be here.
So we're going to start off on a personal note, jump right in.
Yeah.
With so many roles and accomplishments, where do you feel the most home these days?
So I really feel at home in my work. Actually, when I started my concierge medicine business, I'm lucky to have found this office that I share with a chiropractic group, and I felt like this is my second home. Obviously, my home is where, you know, my priority, but this second home of mine, which is my business, is really close to my heart, and you know, I can share with you my journey and how I got to this business.
And that leads right into the next one, all about your journey.
Yes.
You began in the Philippines, studied medicine, and eventually founded your own healthcare practice here in Massachusetts. What inspired you to pursue medicine and later to chart your own path to concierge care?
So I remember when I was a kid, I have this picture in my head. My mom showed me this picture when I was 2 or 3 years old, with my grandfather's stethoscope, listening to my great-grandmother's heartbeat. So I think as a kid, so my grandfather is an OBGYN in the Philippines, and he was really my inspiration in becoming a doctor. So, you know, I remember him taking me to his clinic, with his patients, and I remember him, being loved by his patients. And even though he's a busy physician, he has 8 kids, and he's still able to balance work and life. And he has a great sense of humor. He's very active. He's part of many different non-profit organizations, and leading some of these organizations, teaching in the medical school. So I really look up to him as my inspiration. So I think this is my calling. So since I was a kid, I loved science. I didn't like reading novels. I loved reading science books and doing experiments, watching shows on science. And then this is how I pursued my career in medicine. I did pre-med BS Biology accelerated course, graduated with honors, and then I pursued my medical school in the Philippines, University of Santo Tomas, which is one of the prestigious medical schools in the Philippines. And then I moved to the U.S. My family then immigrated to the U.S. I was left in the Philippines to finish med school. So I decided to follow them, applied to, and got accepted to the Cleveland Clinic, where I did my 3 years of internal medicine residency. I initially wanted to become an OBGYN like my grandfather here, but I heard rumors that the OBGYNs here need to pay malpractice until the last baby they delivered turns 18 years old. Like, I don't want to do that. And then I discovered this Women's Health Fellowship at the Cleveland Clinic, so I decided to go that route. And that fellowship is focused mainly on midlife women's health. So perimenopause and menopause and hormone therapy, anything related to that stage of life. And I really got interested in that field. It was very fulfilling when I did my fellowship in women's health. All these midlife women who express that, I go to my primary care doctor and they don't listen to me. I tell them about my hot flashes and my night sweats and I can't sleep, my brain fog, and they just said, it'll get over it. It'll pass. Just deal with it. And really, I mean, some people really suffer and can't function. So that's why I really had developed passion in this field, because when you help women, give them hormone therapy, when they come back, they tell me that, I feel like a person again. I feel like a human again. Thank you. And that to me is very, very fulfilling. So then I decided to pursue that career. After my fellowship, I went to work here in Massachusetts at South Shore Medical Center. And also I did primary care, and I also did women's health consults. However, with the changing healthcare system, everything got so complicated. It was too much work. Work kept piling up. Patient panel size just kept growing, and it's not sustainable. So I decided to move to a different practice, but it's the same. So the healthcare system is the same everywhere, and I really faced a lot of challenges in the second hospital system. I've experienced, threat from a patient that was really, it was because of a system failure, not really a failure on my part. But patients don't know that, right? So they're directing their anger to the doctor. And that's how I experienced threats where we had to file a restraining order. I was afraid to go to work every day. We had a security guard in the building. As a primary care doctor, I'm always in the office, the first one in the office. I'm the last one in the office. So it's dark, nobody's there. I'm the only one. My car's the only car in the parking lot. It's like after that event, I had to leave with everyone else. And it just got so complicated. I decided to, I just quit. I quit without any plans. But, after 3 months of not working, it's I said, I love working. I want to go back to the medical field. I tried different things. I did research. I did home visits. But then I realized, my passion is seeing patients in the clinic, doing primary care, and, really giving comprehensive, more personalized care. So I decided to go back to primary care, and this time I joined Brigham and Women's at the Hingham Shipyard. I love the people that I work with, but then again, same system, same broken health. It's the healthcare system in general where we had to do admin, checklists from admin, checklists from the insurance companies, documenting X, Y, and Z, and we're losing that connection with the patients because we're just so focused on checking off these boxes. And with very short time spent with the patient as well, it's not how I wanted to practice medicine. And fortunately, when I attended one of the Menopause Society meetings, I found this booth called Miss Medicine, and they're a concierge medicine group focused on women's health. So this is how I started my journey with concierge medicine. It took me a long time to make a decision to pursue this change because of the fear of the unknown, right? I have all these questions in my head. Will patients really pay me to see me to, be their primary care doctor when they're already paying their insurances? Everybody's paying high premiums for insurances. Who would pay me to see them as, be their primary care doctor? And is this sustainable? Is this, all these questions in my head, all the what if. And I'm fortunate I have a very supportive husband, and he's the one who really pushed me to pursue this change. So here I am, started my concierge medicine practice, and I am so happy that I did this because now I'm really able to fulfill my vision. I have this vision since I graduated from fellowship at the Cleveland Clinic. I have written down my vision and my mission on how I picture my practice. And now, after so many years, I'm now able to fulfill that mission and vision without the need for asking permission for the higher ups. Can I do this? I remember one time I brought up a suggestion to our admin people, and I asked them, can I start a women's health consultation at the shipyard? And there's two men who told me, is that really necessary? It's like, yes. Do you know how long the wait time is for a women's health consult at the Brigham at the Chestnut Hill? They have a women's center there. It's like a year wait. I didn't go anywhere. So here I'm able to do what I want to do, take care of my patients the way I want to, offer comprehensive and really personalized care and treating the patient as a whole. And my goal is to be like a one-stop shop for my patients, not just a triage doctor who would say, if a patient comes in for a knee pain, like go to ortho or go to derm or go to cardiology. I want to be the one-stop shop, your go-to, your quarterback. And then, if the case is complicated, then I would refer patients. So that is my journey, and I'm proud to have started this company. I'm happy my patients are happy. I think I'm able to offer better care.
Not a hard sell to this room, I think, right? So I think I've never thought more of you're preaching to the choir, right, as far as being heard and really being appreciated. I know when I have patients that I know are going to the doctor, I say, now you have to tell them you have 4 questions, because if you just keep asking questions, they're going to cut you off, right? Mm-hmm. So you need to say right up, and then check off the boxes. Mm-hmm. Isn't that sad? So you've brought this down a different path. What are some of the challenges that you've kind of come along and, ran into as you've started your own business? Yeah.
So my main challenge is myself, contradicting myself, and the fear of doing this, right? Because of a lot of the unknowns, as I mentioned earlier, like, is this sustainable? Are patients willing to pay? Will I be able to manage the patient care side and the business side of the practice? I don't have a business background. I don't have a marketing background. They don't teach this in med school, right? So that's my main challenge. And I'm lucky to have, again, found Miss Medicine who supported. So Miss Medicine is our corporate concierge group who helped me build my practice. Guided me. What do I need? What do I need to build this practice? From all these licensing standpoint, insurance standpoint, location, marketing standpoint. So it's really a matter of finding the right people to help you and support you. And again, I'm lucky to have my husband to be very supportive and really pushing me to do this.
That's awesome. I'll tell you, it's easier to have confidence when you're part of a team, right?
Yes, absolutely. I could not do this on my own.
And I think a lot of successful people, right, will let you know that they're open-minded and they let people in, right? They count on other people like mentors. So that's a great group for that. As a business owner now, right, and with your values as a physician, how do you balance your role with business and medicine?
For me, patient care comes first. So I'm primarily a doctor first. So my priority is my patients, their health, and then second is the business. So from a business standpoint, again, I have all these people that support me to run my business. I had to learn everything. So from, purchasing, medical supplies and office supplies and learning the admin portion of my practice. I had to learn all that, checking in the patients, checking out patients, how we do billing. I even started doing blood draws in my office, and I haven't done that in a long time. So because I need to learn all of this, so I would know how to create the protocol, right? How to be efficient in the office. So it's really a great learning experience for me. But balancing being a physician and being a business owner, my priority would be my patient and then the business second.
I can personally attest to that because we were talking about today and a patient called and and we stopped, and it was patients first.
Yeah.
So
Yeah.
you really do walk the walk.
Yeah.
And I think that's amazing. So that's wonderful. How, with all of those roles and the hats that you wear, do you still stay innovative?
Yeah, so the beauty of owning your own business is you can be innovative, right? You can be open-minded. The sky's the limit. When I was in a large hospital system, you're tied to what that hospital system offers. But when here, now that I own my business, I'm able to talk to companies that offer innovative testing and innovative treatments. So I'm able to offer more testing that's not offered by large hospital systems. Like, for example, we have this multi-cancer early detection test in the office, simple blood test that detects different types of cancers. So that's one example. And I'm constantly talking to companies that offer, testing of prediction of cardiovascular risk in the next 10 years or even the next 3 years. So it's really easier to be innovative if you own your own company and you're not subject to asking permission from higher ups.
So with that said, what advice would you give to the women and gentlemen in this room who maybe want to start something, kind of get out of the status quo and start something on their own?
Just do it. Just do it. So I've experienced this where I kept thinking and analyzing things, and now I end up with analysis paralysis and end up not doing anything, right? So once you have your plan, you have your vision, you have your goals, write them down, and then just do it. Don't overthink. The more you overthink, the more paralyzed you become, and then you end up not doing anything. I've been there. I've been stuck. But then I had to overcome that analysis paralysis and just get that courage to do what your vision, what you're envisioning.
I think that you had started with a vision.
Yeah.
Also, it's very important. Almost like, those vision boards they talk about. Once you can see it, you can make it real.
Yes.
Right?
Yes. I actually have this plan in my computer, like my vision for women's health and how my practice would look like. And now I've been able to fulfill that vision.
So on the flip side of that, what misconceptions about women's health do you most often encounter?
Yes, a lot. So especially in the perimenopause and the menopause field, right? So again, a lot of the women are not heard by their physicians. Part of it is that physicians also don't feel comfortable managing perimenopause and menopausal symptoms. And I think most of us are in this stage of life. So I myself is starting to experience the perimenopausal symptoms. You start having hot flashes, the night sweats, the brain fog, interrupted sleep. You have joint pains. You have everything dries up, dry hair, dry eyes, dry mouth, dry vagina. It's like, and when you bring these things up to your doctor, oftentimes they would brush it off and say it'll pass. These menopausal symptoms would go away with time. Just deal with it. So now my goal is to educate midlife women that there's something we can do about this, right? We have treatment for these symptoms. You don't have to suffer. And my advice to women is to advocate for yourself. If your doctors are not listening, you need to find somebody who will listen and really address and help you manage these symptoms, because this is a very difficult stage of life. You're in the middle. You may have kids that you're helping. You have elderly parents that you're taking care of. You have your spouses, and oftentimes you're left not taking care of yourself, right? So self-care is very important. Take care of yourself first before you can take care of other people.
How do we do that? That's the $1,000,000 question, right?
It's very difficult.
Very difficult, right? We talked even.
Yes. As women, our focus is to take care of the people around us, and we're always the last. But it shouldn't be that way. Like, take care of yourself first, then you'll be able to take care of the people you love.
So with that said, what are some small, powerful steps we can kind of adopt to help us take care of ourselves first, to put our own oxygen on first?
Yes. What can we do? Put your own oxygen on first, right? So self-care. exercise, eating healthy, make sure you're sleeping well. If you're not sleeping well, you get moody and you get irritated, and then your patience is short. Right? So, can anybody relate to that? Right? So we really, really need to focus on ourselves. I put it on my calendar, right? Time for exercise. That's very important. If it's not on the calendar, it doesn't happen. Right? It's optional. But if it's on your calendar, it's not optional. You have to do it.
I remember my cat being due for distemper, and I had this aha moment. Like, oh, she's due. I wish we could just go once a year, right?
Yeah.
And have like a distemper moment. All right. The emphasis on self-advocacy really aligns with leadership. I really think it does. To be a leader, right, you have to be in good shape to lead, because caring for others starts, like we said, starting with ourselves. How do you maintain a sense of balance and joy in your life?
I like to dance, so I want to make sure that, I go to, I used to do ballroom dancing classes in Hanover, but when my schedule got busy, I stopped, but I still love to dance. I dance whenever I get a chance to, when there's galas or organization events that I go to. There's always dancing, and dancing makes me happy. So choose the thing that will make you happy, and make sure you do that, whether it's dancing or exercising or doing yoga or cooking or knitting. You need to have an outlet. If you don't have an outlet, it's gonna work is going to consume you. Everything that you do is going to consume you, and it's going to be hard to function. So make sure you have an outlet. I still have this on my bucket list, is to join a ballroom dancing competition.
I love the outfits too. Right? Yes. The outfits are fabulous. And a little motivating to keep in shape.
Yeah.
Generally. I know you talked about your grandfather. What current mentors are in your life today that help you along your journey?
So the mentor that I loved when I was doing my Women's Health Fellowship, Dr. Holly Packer. She's my medical director in Women's Health. She's just a great leader. She's a great mentor. She's my inspiration. She's a great educator for women, and that's how I learned a lot in this field. And then my second mentor is Dr. Judy Donald. She was my medical director at the Brigham and Women's Hingham Shipyard, and she truly advocated for all the doctors, all her staff, and she would support them in every way she can. So that I really look up to her in her leadership role. My other, not really considered as a mentor, and I always mention him, is my husband, who's always there, and he actually sometimes acts as my therapist at the end of the day. With a hard day's work, I come home and I just vent to him, and he's actually the one. He's very good at pacifying my emotions and really giving good advice. And now I'm giving this advice to some of my patients, is really learning how to compartmentalize. I know women, we all have we think about so many things all at the same time. It's like a computer screen where all these tabs are open. Sometimes we just have to close all these tabs and just open one tab at a time and just finish that tab and prioritize and learn to compartmentalize. So that's what I've learned from him, and now I'm sharing that with other people. And it's so difficult for women to do that, but I think it's doable.
That's great advice, especially at night, right?
Yes.
Because sleep is so important.
Yes.
To be able to close your tab,
yes,
reset, reset your computer, reset your registries. Through your work with the Philippine Medical Association of New England, what have you learned about leadership through service?
Yes. So I love that organization. When I found that organization existed here in Massachusetts, I immediately joined, because I wanted to, as a leader. So again, you said servant leadership. It's leading by doing, right? And this organization really offered or made me feel more fulfilled. So we organized medical missions in the Philippines. which is very, very fulfilling. And then we also have programs for the homeless in Boston. So we helped feed the homeless. We also gave educational talks, and we had yoga, tai chi for them. So I think, as a leader, serving is very important. It's leading by doing. It just offers a lot of fulfillment in myself. So
that's wonderful. We're lucky to have you as part of the group. So as we wrap up, I'd like to move to a few questions of reflection. Okay. If you could give your younger self one piece of advice, what would it be?
Yeah, it's have that courage, right? Don't think too much about the what ifs, because then you will get stuck. The other advice I'll give to myself is don't undervalue yourself. We have a lot to offer to people, and don't undervalue that. I tend to do that. I'm my own worst enemy. And people around me say that you've done so many things, you've done so many good things and helped a lot of people. And I now realize that I do have patients who thank me every day for helping them, for saving their lives. And these people that we go to for medical missions, they're really grateful. Sometimes I don't realize that. To me, that's just what I do, what I want to do. But again, do not undervalue that. Give credit to yourself.
That's great. So what couple of words would describe your leadership style, do you think?
Yeah, so my leadership style is a leadership of service. I lead by actually doing. I don't just tell people what to do. I actually do it. And again, now in my practice, I do help my medical assistant, right? If she's busy, she's on the phone with patients, and there's another patient coming in, I just room my patient. I don't tell her, stop what you're doing and room my patient. I don't do that. We help each other. And again, I had to learn everything in my business to be able to guide the next staff, right? I'm not somebody who would just tell people what to do. I would do it and then teach.
What different aspects of your life culturally, either your family, where you came from, your gender, that has best informed where you sit today?
Yeah. So in terms of culture or family, my dad was a businessman, so I think I got some business acumen from him. And also I remember when I was a kid, I started selling stuff when I was in second grade. I loved selling stuff. I sold stationeries and stickers and all those scented erasers. It was fun for me, and then it went on every single year in elementary. I think of something to sell, and then in my 4th to 6th grade, I started sewing my own scrunchies and hair clips and headbands, and I sold to my friends and classmates until high school. And every Christmas we would bake cookies or something, and we would sell them to companies to give to their employees. So I think I have that culture background and family background that's helped me now in my business.
That's wonderful. Yeah. What's next for you, personally, professionally? What excites you the most?
Yeah, so what's next is I want to be able to grow my practice more and be able to educate more women about their women's health. I want to be able to teach the future generation of doctors. We definitely need more doctors. And personally, I want to be able to focus on my family. Now I'm able to do that. It was so hard to do that with my traditional primary care. I remember, when I was in traditional practice, I was up at 4 a.m. As soon as I wake up, I turn my computer and I start working. And I end my day at 7 at night. I leave my clinic at 7 at night, and then I just eat dinner, and then I'm on my computer again until I go to bed. And then the cycle repeats. Now I'm able to be done with my work when I leave the clinic, so when I'm at home, I'm focused with my family. I'm able to cook dinner and prepare food for them, and not just the quick meals. And I want to travel with my family. And while my kids are little, I want to be able to spend time with them. That's very important.
That's wonderful. If we're interested in learning more about concierge medicine, what can you tell us that gives us just this really, informative way to approach it and consider concierge medicine?
Yeah, so with concierge medicine, really the focus is providing comprehensive, more personalized, high-quality care for all patients. We don't rush the visits, so we schedule ample time for our patients. Our new patient visits are 90 minutes. So, and some of my new patients would say, I don't think I'm going to consume the 90 minutes. And then on the first visit, oh my God, we did consume the 90 minutes. Yeah, because we talk about a lot of things. I review your medical history. We go over screening, preventive measures, all your health history, all your questions. We address everything on that first visit. And then the follow-ups, we do 30 to 60 minutes. We have annual exams, 60 to 90 minutes, depending on the complexity. And then also access is not going to be an issue. If you're sick, you need to be seen the same day, the next day, so we can accommodate that. I'm available for my patients 24/7. My patients get my direct line. If after office hours they need to reach me, they can call me directly on my direct office line. They can email me. They can send portal messages. There's many different ways to communicate with me, and my patients love that access. Because it's so hard to get a hold of your doctors now in traditional primary care. If you can, most of the time the nurses respond to your messages. But I respond directly. There's no middleman, basically. So. And we also coordinate care. And it's so hard to navigate the healthcare system now, especially for the elderly. So we do help them coordinate their appointments. We schedule the appointments for them if they want us to do that, the imaging. So the labs we do in our office. So it's very, very convenient. Patients love it. And I think that helps improve everyone's health.
Can you just talk a little bit about just the different levels of membership?
Yeah, so in our practice, we have 2 levels of membership. We have the full concierge membership, wherein I am the primary care doctor. I do everything for the patient. And we also have a women's health membership, wherein the patient keeps their primary care doctor, and I see them for all their women's health issues, particularly relating to perimenopause, menopause, and everything related to that stage of life.
I love that. Very good. I want to say thank you, Dr. B.
You're welcome.
Your honesty, your insight, your inspiration. And I'm going to read this because I really, after talking to you and prepping for this, want to use the right words. Your story reminds me that leadership isn't about titles and power, right? It's really about access. It's about courage and compassion and the conviction to lead with purpose. Mm-hmm. So I think, again, we all need to have our vision, right? And start with our vision and have courage. Mm-hmm. So thanks for that. On behalf of the Chamber of Commerce, thank you for joining us today and for empowering women across every walk of life. I'd love you all to share your impressions after hearing Dr. B or any questions that you may have for her. Yes. Lindsay.
So I have 2 questions. I'm making note of Sherry's suggestion in the doctor's office. I have 2 questions. So my first question is, you mentioned that kind of especially of working with midlife, perimenopausal women, that kind of thing, and that's the stage that you're kind of just reaching in your own life. Can you give any advice or insight into how that works, kind of the strengths, the weaknesses of working with patients who aren't necessarily or don't necessarily see you as someone that they can relate to because you haven't reached that, or you hadn't reached that stage of life? Is that question?
In terms of perimenopause?
Yeah, because I think, if you're younger and you're working with a population who says, how can this doctor relate to me?
Okay.
Been through it yet?
Yeah. So when I was younger, a younger physician who's already managing perimenopause and menopausal women, I don't know, somehow I can empathize with my patients. When they tell me their symptoms, I can feel, for some reason, I can feel their symptoms. So that's how I think I'm able to help the women deal with their perimenopausal or menopausal symptoms and understand and treat them appropriately. And again, a lot of these women appreciate that, and when I see them for follow-up, they really thank me for making them feel human again and being able to just function and sleep and, not have any hot flashes and night sweats. So, yeah. And now that I'm in that stage of life, I can relate to them more.
Definitely. Thank you. And
You had a second one.
Yep, thank you. Thank you in general for sharing everything you have. I really appreciate it, and I think, talking about women's health is so important, and it's not talked about. So I think this is a great opportunity for everyone to have that kind of reminder that it is okay to talk about and not kind of tiptoe around it. So my second question, unrelated a little bit, is about mentorship. We've talked about some mentors, and I think that's something that comes up every time here. So this is a question for either of you as well. Any insight or advice on how to, kind of find mentors and foster those relationships?
So I think it's all about networking, right? So attending events like these is where you can find mentors in your own field, right? So I personally attend conferences. So like the menopause conference, I attend that conference every single year, and again, that's how I found this Miss Medicine group. And I also attend, do continuing medical education, networking with other physicians, and that's really how I find my role models in my field. So same as in your field, in your own field, you need to network, you need to socialize, and so that's how you will find a mentor for you in your own field.
Great.
How many patients do you have?
How many patients? Yeah, right now I have a little over 300 patients.
Oh.
Yes. And I'm capping at 325 patients because that way I'll be able to really focus on them. If I do more than that, it kind of defeats the purpose of being available for my patients.
Or having work-life balance.
Yeah, and the work-life balance. Yeah, I used to have 2,000 patients,
Right.
Yeah.
which is unsustainable.
Right. Do you have a question?
Yes, I want to know a little bit more about hormone replacement therapy.
Yeah.
It sounds like my mother went through a terrible menopause situation and was put on hormones, but then hormone replacement therapy was somewhat demonized in the media, and the advice was not to go on hormones.
Yeah.
It seems like things are changing and shifting in the medical field where hormone replacement therapy is really being considered safe now. So tell us a little bit about that.
Yeah, so in 2002, there was the Women's Health Initiative study that came out. So before that, everybody was on hormone therapy right after menopause, and then that study came out in 2002, which showed negative results, meaning, it showed increased risk for breast cancer, it showed increased risk for dementia or heart disease. But the study involved older women in their 60s who were more than 10 years past menopause. So they've already developed risk factors, right? So the older we get, the higher the risk for cancer. The older we get, the higher the risk for cardiovascular disease. And the purpose of the study was to study hormones for prevention, not really for treatment. So that's why the result of the study was negative. And then after that, everyone stopped hormone therapy, and every doctor was afraid to prescribe hormone therapy because of these risks. But when they reanalyzed the study and subgrouped the women, they found out that women who are within 10 years postmenopause or less than age 60 had more benefits than risks. Right, so the mortality rate is lower in younger postmenopausal women who start hormone therapy at an early age. There's more benefits in terms of cardiovascular risk protection, bone protection, again, relieving symptoms that are associated with perimenopause and menopause. So the pendulum has shifted, right? So we are now becoming more comfortable in prescribing hormone therapy, although we still need to educate more doctors to prescribe hormone therapy. And then in perimenopause, it depends. Not all perimenopausal women are candidates for hormone therapy. If you're cycling, you need to be on a birth control pill dose, not the menopause hormone therapy dose. There's another misconception that perimenopausal women are coming to me for, like, no, I heard on social media that, I can take hormone therapy. No, you're still cycling. You need to be on a birth control pill dose, not the hormone therapy dose. So there's I treat my patients individually, listen to their symptoms, look at their age, their cycles, etc.
It's a good question.
Yeah.
Very good.
Hope. Yes.
This is more of a statement.
Yes.
I met Dr. B when I was really, really, really sick and coming off of out of a different system that totally gaslit me, and I was really, really sick. And she is way better than Tom Brady at quarterback. She has nothing on you as a quarterback. And I just want to rave about you because you literally changed the course of my health. And took me seriously, looked at the whole person. And medical trauma is real. The gaslighting is so real for women, and you've turned everything around for me, and it's why I'm so healthy today. So I just want to thank you.
Thank you. Appreciate that.
Someone needs to ask, how does she replicate herself?
I'm fascinated by the member-based primary care. In the world of insurance companies, do you see this as the future of how this is going to shift? Because
I think
it's insanity.
It is insanity. A lot of doctors are transitioning to concierge medicine, really, because again, the traditional healthcare system is not sustainable both for doctors and patients. Right? It's all just go, 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 go. I felt like I was running a marathon every single day when I go to work. Every 15-minute visits, you're just going from one room to the next, and then I tell my patient, okay, you have, you just need top 3 things that you want to discuss today. But to me, I feel like I always extend to that because these top 3 symptoms might be related to the other symptoms that they're experiencing, right? So that's why I can't ignore things. I'm somebody who I've done that before. Maybe I should just ignore this. No, I can't. I have to keep asking questions. So that 15-minute visit is really, really not enough. So I think a lot more doctors are transitioning to this concierge because doctors want to give good care, right? We don't want this business focus on volume. We want to focus on quality.
I think that's very much the onus of almost any entrepreneur, right? That you can't accept the way something's being done. So you have to do it the way you see it, right? I think what makes you hold your nose and jump is this, right? This intolerance for subpar quality.
Yeah.
So I think that has a lot to do with it.
My question was almost to your point of replicating yourself. Do you anticipate taking on a partner? Because I imagine that the demand is going to really increase.
Yeah, I really didn't expect the demand to be this much. I predicted having 100 patients at the end of the year, but then I had 200 patients at the end of the year, and now I'm almost closing my panel. So I'm thinking about bringing in another provider next year. So so I think once my panel is closed and there's a wait list, I'm going to bring in another provider.
Mm-hmm.
Yes.
Another question about HRT. I've never heard anyone address, if you start taking HRT at 55 and you live to be 85 or 95, what's the effect of taking those hormones for decades past when normally would happen?
Yeah. If you started at a younger age, there's no time limit to hormone therapy. In the past, there was a recommendation of taking hormone therapy for just 5 years and then you have to stop it. Not anymore. So there's no time limit. As long as you need it, you can continue it. And again, we evaluate the risk factors every single year, make sure you're still a candidate for hormone therapy, and that you don't have any contraindications. And if you're doing well, we can continue that for how many number of years.
How does insurance fit into this? Do they generally how does
Good
it
question.
work financially?
Good question.
Yeah.
So we basically charge a yearly membership fee, right? That covers unlimited number of visits for the year. We don't bill insurance, but the patient still needs insurance to cover their labs and and imaging referrals, etc. The preferred insurance for a concierge practice is a PPO because that's not restrictive. If you have an HMO, that HMO needs you to have a PCP within the insurance network. So if you see an out-of-network PCP, say I order an MRI, the insurance will likely deny that coverage because I'm out-of-network.
Yeah.
So insurance is still needed.
Yeah. And then do you run up against
the same things you probably ran in the hospital system where you wanted to give an MRI, but maybe you needed 3 boxes checked and you could only have 2, but your gut was telling you. Yeah, so you run up against that.
I still
same,
run, but I want to make sure that I document everything, my reasoning why this patient needs an MRI, and when they do a prior authorization, usually it goes through.
Okay.
As long as there's adequate documentation and support why I want to do this test.
So, just a follow-up, so would my insurance with the PPO, would the co-payments and everything else do?
No co-pays, yeah, so if you pay a membership fee and you have insurance, when you see me, we don't charge any co-pays anymore, because you're already covered by that membership fee.
Would the insurance still cover the membership fee or no?
No.
So that's
it's an out-of-pocket expense.
And what does that range from?
So this year it's $4,500 for a full concierge membership. I see my patients at least every 3 months, and as needed in between. If you're sick, you need to be seen urgently, so we schedule that. And then for my women's health membership, it's $2,750.
And is that typically paid upfront of the year, or is it monthly payments, or how does that work?
Yeah, so there's an option to pay annually, semi-annually, or quarterly.
So that's the only thing out of pocket? And then the insurance carries
everything, yes. Prescriptions, labs, everything goes to insurance.
With the PPO?
With the PPO. I do have some patients who have HMO, and the trick that they do is they keep their PCP on file with their insurance, but they see me as their PCP. So that's their backup. So let's say I order a referral to a specialist and their insurance denies it because I'm out of network, then they would ask their HMO PCP to order the referral for them. So there's work around it.
Yeah. Any others?
I have a question.
Sure.
Is there a referral network that you have with concierge? My folks, my mom and dad live in Maine. Is there a network of concierge providers that you can refer to or that they can find? Because I know my mom, her primary care physician retired, and she's going to be 85. She's having a devil of a time trying to find a doctor.
It's really hard to find a PCP. For concierge medicine, my network is within Miss Medicine, and I don't know right now. There's no concierge doctor within our network that's in Maine.
But there's a trade association.
I don't think so. I know there's a direct primary care association, but I'm not part of that.
That's fine.
That would be a great AI question, I think. Truly.
Yeah, that's a big
It'll pull from everywhere, too.
Yeah.
And pull on the word concierge, right, Madison?
You can look for MDVIP. MDVIP is a concierge practice group that has more offices and locations across the U.S.
Yeah.
Thank you again.
You're welcome.
Wonderful.
We do have another member who's in concierge medicine. They're in Braintree, so I can share that with you. They're
Action medicine.
They're Action Medicine,
yes.
and Dr. Mike is great. His practice is great, and I'm sure Dr. B knows him as well.
Yes.
So he might have referrals as well to talk to, so I can help you with that, John. Yeah. Thank you, everybody, for coming today. Thank you. It was super nice. Thank you, everybody. I love hearing about these things. I do not have an agenda, but a couple of weeks ago we had another doctor on WATD who talked about hormone replacement therapy. I didn't plan it, it just happened. But hey, it's important, and I'm glad that these conversations are happening. So, our next will is November 4th. It'll be here. It is with Bonnie Simmons, who is a partner at Citron Cooperman, but she is also our board chair here at the Chamber. So she has a great story, and she's done a lot, and she works really well with us here at the Chamber, and we're happy to have her this year. It'll be here, and it'll be our last one for the year. And thank you again to our sponsors. Sponsorships will be open in a couple of weeks for anybody who's interested, or send me an email about 2026 sponsorships. And that's pretty much it. You guys can continue to network and talk, and we do it.
Thank you. Thank you, Dr. B.
Thank you.